Good afternoon, everybody, and welcome to what we've described as the Mayoral Vaccination Roundtable for faith and other communities. Very pleased we're doing this afternoon because we know there is nothing more important than maximising the rate at which vaccinations occur across all communities across the West Midlands. You'll be pleased to note that you're not going to have to listen to politicians this afternoon. We were told last week the public want to hear from experts, not politicians. So I'm merely going to chair it and then pass to the experts who we have brought together. And I'll introduce them in just 1 second. There will be plenty of time after they've each spoken for questions. And if you want to ask a question, you need to submit it in written form through the question function that you should be able to see clearly on your screen. So there we are. Please get them in, and I will try to read them out and put them to the right person. We'll get through as many as we can. Now, in terms of who you're going to hear from, I'm very pleased that we've brought 5 experts together. First of all, Dr. Justin Barney, who, as many of you will know, is the Director of Public Health for Birmingham City Council. Then I'm pleased to say we're going to Dr. Ash Banerjee, who is actually a very, very grand title. He works for Public Health England and is actually the screening and immunisation lead for the Midlands. So real specialist subject for him, this. Then we go to Dr. Sarah Raistrick, who is the chair of the Coventry and Rugby Clinical Commissioning Group and has actually been leading the whole vaccination effort across Coventry and Warwickshire. Then I'm pleased to say we're going to go to Dr. Rizwan Alidina, who is both a GP in Stechford, so frontline experience there, and is also a member of the governing body for the Birmingham and Solihull CCG. And then we go to the man who's the most famous man in Birmingham now, Sheikh Nehru Mohammed, who of course is the Imam from the Al Abbas Islamic Centre in Clifton Road in Walsall Heath, where of course vaccinations have been administered. So with no more ado, let me pass over to our experts, and the whole mission is to answer your concerns and to give confidence in this programme. So Justin, you're first.
Thank you, Mayor. So I'm just going to give a brief outline of where we are in the COVID before I hand over to colleagues, and apologies I can't stay with you long today. What we're seeing across the West Midlands at the moment is that the case rate of COVID cases is starting to come down. The most recent accurate data is up to the 26th of January with a case rate of 371 cases per 100,000. That's for the West Midlands region. That was a drop of about 32% compared to the 7 days previous to that, which I think is a good sign. And we're certainly seeing the rate of descent now in the West Midlands moving slightly ahead of the national rate of descent. However, when we look in more detail at the case rates in our over 60s is only reducing now to about 284 cases per 100,000, and it's coming down at a slower rate than the case rate in other ages. Similarly, when we look at what's happening about mortality, our mortality rate in our over 80s is not reducing as fast as some other areas. And that's why vaccination is so important. The approach we're taking with the vaccination rollout is to reduce the risk of death and going into hospital, which really starts to show impact after that first dose of the vaccine. The second dose reinforces it and gives you protection from infection and lasts longer, but that first dose is what will really bring down the deaths. And sadly, what we see and have seen over the last year with COVID is that it shines a harsh and cruel light on inequalities that already existed. And across the West Midlands region, many of our areas had a life expectancy far short of the national average. Even within Birmingham, there is a 12-year difference in life expectancy and birth between some of our poorest areas and our most affluent areas. And you add COVID into that mix, and unfortunately it has hit communities very, very hard. What is more positive news, and I know the Mayor always likes me to try and get to a positive note when I end these things, is actually we're seeing the case rates come down in all age groups and in all ethnicities. And that really reflects, I think, the strong partnership we have with faith communities across the city and across the wider region, that we're not seeing the case rates in, say, our Asian community staying high when it's coming down in our white community. They're tracking in the same direction. And that's a really reflection of how everyone is standing together to play their part. You will have seen in the news today concerns around the new South African variant, what's called a variant of concern. And these are variations of the virus, which either means it has an increased risk of death, it's more infectious, or there's a concern that the vaccine may not be as effective if you catch it. And government is rolling out at pace a very rapid response to when we have these cases. Now, we will have cases across the West Midlands, and my ask of faith leaders is to work with us. When the call comes and a local authority says we are doing enhanced testing in a specific area, please add your voice to that call and encourage everyone to take up the testing, because we defend best by being able to identify these variations of concern quickly and containing the spread. And I'm sure there will be more of that coming out over this week as we're starting to see some of these cases appear across the country. But overall, direction of travel is where we want to go. We have a long way to go, I fear, to get back down to where we were even back in November. So, the light is still there at the end of the tunnel, but it is a way off, and vaccination is an important part of that journey. So I hope that's been okay, and apologies, I have to leave you early today.
So I'm just going to ask one question of you straight away, Justin, because it's come in as you've been speaking, and as you're going to go, I think it's right we get to it. And it comes from Ryan Dilks in, I presume, in Walsall, and it simply says, how concerned should we be about the discovery of the South African variant in Walsall? Because I think you are the best man to answer that question. So it's a very topical one, so let's have it out.
Yes, well, that's why I thought I'd talk about it head on rather than avoid it, because
Exactly.
I think it is important. Viruses change, that's in their nature. There have been thousands and thousands of variations on COVID-19 since it was discovered back in December 2019. And the majority of them, either they don't do anything at all, or actually they make the virus it survives less easily, so it dies out quickly. There's a small number that become this variant of concern, where they are more infectious or more fatal, or there is a concern that the vaccine won't be as effective. The South African one, we have seen take dominance in South Africa. There are actually 2 variants out of South Africa. And they account now for 90% of all of the new infections in South Africa. There is some suggestion that it is more infectious and it may have a slightly higher rate of hospitalization. There are also concerns that we know the vaccines work against the South African variant, but they don't work quite as well. And that's a small difference, but an important difference. And therefore, we've all got to play our part now in trying to keep them under control and stop these variants spreading. So where you do see it in the news, Walsall is the first. There will be others in the West Midlands, I'm sure. Please step up, please help us get those communities. There'll be specific geographical areas where we're asking everyone to test over a week. And the ask for you as leaders in your communities is encourage people to do that, because it's the decisions that individuals make that stop this spreading. And in order to contain the South African variant, we really need to identify every case as quickly as possible and to contain the spread.
Thank you very much, Justin. Okay, next then we're going to go to Dr. Ash Banerjee, and I won't tell everyone everyone's job again. I've done that once, so Ash, floor is yours. Yeah.
Thank you, Mayor. I thought today I'd just tell people a little bit about the science behind the vaccines and how we got to where we are today. So I was going to talk broadly around the effectiveness of the vaccines, the safety, and the reasons we're prioritising the way we are, which I think is probably the kind of questions you will get from your residents and from the people who attend your areas. I mean, the effectiveness is fantastic, because when we started this journey, we were hoping, if we're lucky, we may get 50% effectiveness, and we would say that is success. What we've got actually is vaccines which can prevent 70, 80, 90% of deaths. So we have, come a long way. So I'm so glad about that. And as we've learned about vaccines, we've also learned a few things. We've learned that a single dose will give you at least 70% success within about 3 weeks. We know that protection will last for 12 weeks, and we know that when you then have your second dose, you'll get a further boost, and then you'll have a longer protection. We don't know if that protection will mean you need a booster later in life or next year, but we know at least for a while you'll be protected. And when I talk about protection, I'm talking actually about deaths. So I'm talking about severe disease, people ending up in hospital, in ITU, and deaths. So that's great news. there are other things though going on as well. So although it gives you protection against deaths, we don't know whether it stops you transmitting disease. So even if you had the vaccine, it's still really important people stay at home, keep distance from each other, ventilate their rooms properly when they're indoors. All of that has to continue, unfortunately. It may be as we learn more and more about these vaccines, we may be able to relax some of those, and or when more people have been immunized. In terms of, sometimes people say this is a very new vaccine. Do we know it's safe? Do we know it works? Well, it went through some very rigorous trials. They've all been reviewed by, really good quality organizations, the JCVI, the MHRA. These are top quality regulatory groups that look through all the evidence. And they are all also there for all members of society. So for example, in the Pfizer phase 2 and phase 3 trials, we know that around 10% of the participants were Black, 5% were Asian. So we know these are results that count for everyone as well. So I think effectiveness is very good, but we still have to be careful after we've been immunized. And as Justin says, at some stage, we don't know, maybe we'll need boosters, maybe there'll be a variant where the vaccine doesn't work quite as well. It's interesting though, because we've got this new way of doing vaccines. These are called messenger RNA vaccines. We have got an option or a possibility that we're able to produce changes in the vaccine, a bit like how we do with flu at the moment. Secondly, on safety. So these are safe vaccines. Typically you won't necessarily get any side effects. If you do get a side effect, it may be a sore arm, you may get a mild temperature, that kind of thing. There are very, very few people who can't have the vaccine. So, people with other underlying diseases, that kind of thing is fine. It tends to be only if you've had a very severe allergic reaction to a vaccine or one of the constituents of the vaccine or one of the other kind of biological products. And also, we now have done about 5 or 6 million doses, and we've got a great system where if clinicians are worried about adverse effects or side effects, they're all being reported in real time into the MHRA, and that's called the yellow card system. And again, our initial feedback from MHRA is that the signals are as expected. So we're getting the kind of things that we picked up in the clinical trials. We're not getting any other kind of new concerns, but it's really reassuring to get that real-time experience back. Finally, I just want to explain about why things are being prioritized the way they have, and it's all about deaths. So what we know is, if you immunize 20 people in a care home, you'll prevent 1 death. Whereas if you wanted to prevent deaths, say in those who are shielding, you'd have to immunize several hundred people. So age is the key factor, and that may be slightly counterintuitive. You may think a 40-year-old with asthma probably is more at risk than a 60 or a 70-year-old. That's not true. It's actually mainly about age. And that's why this particular group now until the 15th of Feb is around age. And it's also about those who through their work are more exposed to getting COVID. So it's also healthcare workers, social care workers, and care home workers. And then finally, I just mentioned around kind of BAME communities. So we do know that COVID is more severe and you're more likely to get it if you're in certain BAME communities. That's not necessarily a genetic thing. It's probably more to do with the jobs people do and their underlying health conditions. So actually, if we can make sure that those people in those categories now come forward and accept vaccination, we will get great success. Because, but what we don't want is within those groups, say the over 70s, we don't want certain ethnic groups to have very high uptake and other groups to have very low uptake, because that is what's going to really widen those inequalities. And whichever way you look at it, this is a long, hard slog. So this will take a long time, and it will take a while for people to recover and communities to recover. So we need to get that right this time. Thanks.
Thank you very much, Dr. Banerjee. Right, so that's very much the thinking behind the programme. Then I'm going to go to one of the people who's really working day and night to make it happen, Dr. Sarah Raystrick from Coventry, and the programme progress there. So, Sarah.
Great, thank you very much, Mr. Mayor. Yes, so I am a GP in Coventry, and I've got a very good team working as GPs, but also with the clinical commissioning group to make sure that we are rolling out the vaccine and getting it where it needs to be. As you're well aware, and you've heard already, that vaccination is the key focus for the NHS at the moment. And in Coventry and Warwickshire, so far, we've delivered over about over 108,000 vaccines. We vaccinated 85% of our over 80s, and that was before the weekend. And I know we've been vaccinating very busily over the weekend, so that number is going up all the time. And our over 75s, we think, are now about 80% vaccinated. And those of you in the community that are of age 70 and over, or who've now got what would have been called the shielding conditions or are severely vulnerable, will be invited along for your vaccine. So that's where we're up to locally. The way we set things up, as a lot of you will be aware, Coventry was the first place in the world to use the Pfizer vaccine in a non-trial setting. So that was very exciting for us in the West Midlands to be able to do that locally. But now, as well as the hospitals, we have centres, as you do across the whole of the West Midlands, in a real variety of places. So we're going to hear later about places of worship that have got vaccination centres. But across Coventry and Warwickshire, we've about 20 vaccination sites right in the heart of the community. So shopping centres, village halls, golf courses and GP practices. We've a couple of pharmacies locally that are now offering the vaccine. And last week, as well as having Millennium Point in Birmingham as one of the mass vaccination centres people local to us could go to, we've now got Stoneleigh, which is just over the border from Coventry and Warwickshire, so a mass vaccination centre that we've got locally as well. So this is all really good news to make vaccinations accessible. We've also vaccinated our care homes. There was a lot of political announcements today about nationally having vaccinated all care homes, and we believe that in Coventry and Warwickshire, bar a couple of homes that have had significant COVID outbreaks where it's not been safe or appropriate to go in, we have vaccinated or offered vaccines to our care home residents across the patch. Really important that those of you that are in contact with frontline healthcare workers are actively promoting the vaccine to them as well, and to our care home and social care staff. We've heard from Ash about the vaccine, and he's given you some really good scientific information. In Coventry and Warwickshire, and as you have been doing across the West Midlands, we've been meeting with faith leaders and community leaders to hear questions, concerns. We've had the offer of Coventry Cathedral and some mosques for our vaccination centres, which we haven't been able to take up the offer of, but we are looking to use for things like testing centres or additional community centres for people who are needing extra support. So communicating with our community messengers has been really important to hear. I know in the NHS we can often tell you a lot, but to really listen to what it is that are going to be the barriers or already are the barriers. So we've heard some things about car parking and accessibility at some of our sites, really important feedback. So I would urge you to keep that feedback coming, please, because we are doing the best and we're acting in very well-intentioned ways, but when there are unintended consequences, we really would like feedback, please. So thank you for this being a two-way dialogue. I think really the key messages to get across, in just one thing in addition to what Ash said, to pick up on a point, was I've got quite a lot of patients at my surgery, and we'll see what the other GP on the call says, but who say, oh, but I'm quite unwell, I've got these medical conditions, is it safe for me to have the vaccine? Should I have it? Won't it make me ill? And my response really is, you are exactly the people, when offered in the priority order, that must have the vaccine, because if you get COVID, you will be the ones who get particularly unwell. So please, if you can pass on that message, that would be great. And then last of all, we've got some great news, haven't we, about how the vaccine programme is rolling out. We know that the most important thing we can still do, though, is to maintain the hands, face and space message. Really important, even if you've had the vaccine. And we know that this is, it's sort of well-worn language really, isn't it? But this is a marathon, not a sprint. We're going to continue the vaccination rollout. We've done a really good job so far. Looking forward to continued dialogue as to how we can make it even better for people. but this is not something that is going to go away quickly. So please, everybody's efforts in understanding that we've set things up quickly, we're getting things delivered quickly, but we've a long way to go yet. Thank you.
Thank you, Sarah, and thanks for what you've done so far. And next, then we go to Dr. Rizwan Alidina. So, Rizwan, your floor is yours.
Thank you very much, Andy and Mr. Mayor. And it's a pleasure to be with you here today to represent the Birmingham Solihull Health CCG. I think likewise, we have been working hard, and we have a slightly bigger batch to cover than our colleagues. But I'm glad to announce that as far as the 30th of January was concerned, we have just done over 142,000 vaccines throughout Birmingham. I can also confirm that most of our over 80s, about 75%, have now been covered, and all our care homes have been covered, barring a few who have had some outbreaks and where it has not been safe to go in. And that includes carers as well within the care homes who have been covered, as they are the key areas of care that the residents receive, and it's important for us to protect them so as to protect our elderly population. We have also been working with priority groups in the meantime. One of the priority groups that we are proud to have covered as BSOL CCG, apart from the health and social care workers, have been the burial volunteers from within various mosques. Now, you may be aware that Birmingham having a higher Muslim population, we tend to have volunteers who do our undertaking rather than undertakers themselves. And these are people who are usually lost to the system because they don't have any professional registrations and ways of being tapped into when we need to protect them. And they are the ones who are covering COVID burials, sometimes up to 5 to 10 a day. So I'm pleased to announce that as a CCG, we have reached out to the Birmingham Muslim Burial Council and to various mosques in various groups, and we have made sure that they have available appointments for these volunteers to be covered. Likewise, we have 3 tiers of sites that we're using for our vaccination at the moment. One is the Millennium Point, which is a mass vaccination center. Then the second is the hospital sites, where we're doing a lot of our health and social care staff, and also for patients as well who are able to attend. And the third is the PCN GP sites, which are about 32 of them across the city. And with now introducing the 4th tier, which is the pharmacies, and also vaccinations at other community areas, such as the Al-Abbas Islamic Center and ASDA in Cape Hill rather. Cape Town would be nice, but Cape Hill. So essentially, we are covering a lot of area. We are trying to get as many jabs as possible within our population, and we have plans for a few more sites to come live over the next few weeks. Now, one of the things that I wanted to perhaps add to regarding the vaccination, and one of the questions that I'm getting as a GP in the front line, is regarding fertility and issues around fertility. I can reassure everybody that there are no issues around fertility that have been found out from the vaccine, and that it is entirely safe for those of childbearing age. It does not alter the fertility in any way. The other thing also I'm finding is that apart from people with chronic illnesses that Dr. Rainstrick was talking about, I'm also getting a lot of concerns from the BAME community. And Birmingham is made up of a significant amount of BAME community, and there are lots of messages which are going around various WhatsApp groups and social media outlets, which are essentially skeptical of the vaccination message. And my message to the BAME community is that this vaccination is actually more important for you than you probably are thinking it is, particularly because BAME populations tend to get a lot more complications and are particularly more likely to be in frontline jobs. Therefore, it is important that you are protected. And my plea is, if you are going to be sharing any messages on social media, even if you decide yourself not to take the vaccine, please do that responsibly after having checked your sources, because by doing so, you are giving importance to fake news. And this is what I'm sure Sheikh will talk about. And this is probably his area of expertise. So yes, in short, the message from BSOR CCG is that we're going full steam ahead. We're trying to vaccinate as many people, and we're gathering steam as we're going along. Thank you.
So, Doctor, thank you. And you answered one of the questions I got in my hand, which came from Divya Khanna about long-term fertility impacts. So thank you for that. Can I just draw out one other specific question, which is very precise, which is related to what you were talking about, and that comes from John Evans. Is there any judgment on pregnant women and vaccine safety? Are women who are currently pregnant advised to have the vaccine?
So I think ladies who are currently pregnant need to discuss with their GPs regarding the vaccine. Currently, we are not offering it to ladies who are pregnant, but then they are safe to take it straight after their pregnancy.
Okay, thank you very much. Okay, right then, lastly,
could I just come in there, Sorry, Mr. Could I just talk about the pregnant? Yeah. So
yes.
Initially, when the program started, we weren't offering at all to pregnant women or those breastfeeding. This is basically because it's not a live vaccine; it's a dead vaccine. So dead vaccines generally are safe in pregnant women and breastfeeding, but as a precautionary principle, we didn't offer it. The latest guideline now is that we would have a discussion with women. So for example, say you were in a healthcare work or you worked in a care home, and it's all around benefits and risks. So if you're at high risk of COVID disease, then there would be a discussion and there'd be informed consent, and you could have the vaccine. And it's not that there's any positive evidence that the vaccine causes any harm. It's just that we don't have total evidence that it's safe. I know slightly nuanced point. So we think it's safe. It should be safe because it's a dead vaccine, but we haven't had enough experience to know it's safe. So at the moment, we only offer it where there's a really high kind of risk.
And obviously, it's so important, this question. Sarah, do you want to add to that? Or are you happy with what's been said?
Yeah, I'm happy with what's been said. I think we would say that weigh up your individual risks, and I think from a faith community perspective and a general community perspective, we've had a couple of cases where someone's been vaccinated and then inadvertently, as a care worker, found out they were pregnant afterwards. Absolutely, that is not any medical grounds or reason to not continue with the pregnancy, and I think that's something that's really important. We don't, that nuance of not having the evidence, but actually it's not something that medically we would be concerned about on those grounds if someone happened to get vaccinated and then found out they were pregnant.
Thank you very much. Glad we dealt with that properly. So last speaker now, then we go to Sheikh Nuru Mohammed, of course, from the Al Abbas Islamic Centre in Balsall Heath. Sheikh.
Thank you, Mr. Andy, and good afternoon, my dear brothers and sisters. It's indeed a great pleasure to be with you this afternoon to share our experience as Al Abbas Islamic Center in administering the vaccine at our mosque. So I'd like to touch on 4 simple things. Number 1 is to look at how did it come about that Abbas Islamic Center is COVID-19 vaccination hub. And number 2 is to look at our motivations, what motivated us as a Muslim community, as a mosque, to allow vaccination to be administered at our mosque. And number 3 is to share with you our experience so far. How has it been? And the last but not least is my own personal experience of receiving the jab, and maybe 1 or 2 messages to our faith leaders, whom I believe have crucial role to play when it comes to disseminating correct information to our people. So it came about when Masters Group of Pharmacy, who are integral part of our community and proud members of our mosque, thought of applying for becoming vaccination providers with NHS. So they shared their idea with our executive committee, who are the main decision makers of our organization. Thankfully, the executive committee welcomed the idea and approved it. And that's how it started, really. And what were the motivations? Because as Mr. Andy mentioned earlier on, we are the first mosque, administering vaccination in the entire UK and probably in the entire world, because we've not heard of any other mosque administering vaccination across the globe. We had so many interviews from Saudi Arabia, from Turkey, from other countries. We've not yet heard anything from Al Jazeera. So we're still looking forward to hearing of another mosque following our footstep. Our motivations are very simple. First motivation was really sense of responsibility. I think we owe it to NHS. They've been incredible. We can't pay them. So it is this sense of responsibility that motivated our executive and the entire community and someone like me as a faith leader to really approve something like that. It is religious and moral obligation to save life. It is non-negotiable. So that's number one. Number two motivation is to encourage ethnic minority to really go for the jobs when they are invited to do so. Because we thought that is very, very important, because ethnic minority really suffered and we lost a lot of lives in the process. Third motivation is to dispel fake or misinformation. It has done some damages here and there, but I think it is our duty and responsibility, especially faith leaders, to keep talking against these fake news. And that's one of our motivations, thinking that by allowing our mosques to administer this vaccination, it will dispel a lot of fake news. And the last but not least is service to the wider community, because the vaccination center at our mosque or the hub is not only for Muslim community, but it's service to the wider community. How has it been? It has been amazing. These are some of the benefits that we've seen. Number one, I know of people, in fact, Mr. Andy, almost every week, I receive more than 5 to 10 calls, asking me, do you really trust this vaccination? Is it halal? Is it acceptable in Islam? Ever since we opened this hub at our mosque, I can say maybe 1 or 2 people tend to phone me. Are you sure it is happening at the mosque? I said, of course it's happening at the mosque. So that's really very important. And number 2 benefits is that we received so many calls from local mosques and national mosques, across the country. How did you do it? We would like to do something like that. And maybe in a few weeks to come, we'll see some of the mosques administering vaccination at their centers. Personally, I received my first job, being someone working closely with vulnerable and also burial volunteer of my community, running up and down burying people week in, week out. And most of them died out of COVID-19. It's simple and it's safe. And most importantly, it will save a life and take us back to some sort of normality. So my simple message to my dear brothers and sisters, faith leaders across West Midlands, is that we've got a very important role to play here. When we speak, people listen. As faith leaders, people listen, people respect us. We are pivotal and central to our organizations and our communities. And we've been doing incredibly well, especially through West Midlands, Combined Authority, Faith Strategic Group. Let's keep doing it. We will win the battle. I have no doubt in my mind we will win this battle, and we have nothing to worry about. Let's just keep doing it and informing people that this is the right thing to do and go for it. Thank you so much.
Thank you very much. And I have to say, you've got a spontaneous response from Amrik Ubi, who will be known to most on the call, I'm sure. It simply says, well done to Sheikh Nehru for leading the way with faith community engagement and places of worship's involvement. So well done you. But the question that also comes up from Mark Goff, and I think it's a very interesting question, it's for you, Sheikh, on the back of what you've just said, is, brilliant job. But why do you think it is that there is still some reluctance in some communities that, despite everything that's been said, is still needing to be moved on? So what's the resistance?
I think the resistance is, is conspiracy theory. People holding these views that it's not acceptable from the religious perspective, they still spreading those messages via WhatsApp, Facebook, different social media platform. So I think it is our duty also to take those messages from NHS to assure our people and share those correct messages on our social media platforms. And I think the more they do and the more we do, we'll be able to conquer them. We should not allow them space. Yeah.
Thank you. Thank you. So the next question is so I'll tell you what I've got. I've got one or two sort of ones about the health around the vaccine. I've got some specific questions about organisation. Then I've got a few about Warsaw specifically. We're going to go there. So the first one I'm going to put to you, Ash, and it's from Mahmoud Dalla. There is still a concern from some people about long-term side effects. Can you give reassurance for about any long-term effects of the vaccine? So Ash.
I think for anyone who's thinking about these, I totally understand why they would have these concerns. I mean, we honestly don't know the long-term effects of the vaccine, but we also don't know the long-term effects of COVID infection. I mean, what we do know is COVID infection is dangerous, can kill. If it doesn't kill, you can get long-term effects of infection. What we do know is, COVID vaccine is, similar to other vaccines. We know vaccines generally are very safe. We know this is a dead vaccine. So, we have no reason to worry about the long-term effects. As we use this over time, we are keeping a really close eye on the impacts through Yellow Card and other systems. So, I personally would have no concern, because what you have to do when you make this decision, you're weighing up two things, aren't you? Should I have the vaccine or should I not have the vaccine? And the benefits of having the vaccine are very, very clear. The potential disbenefits of having the vaccine, they are just conjecture. It's just, it may or may not happen. We don't know. For me, it's a very simple kind of calculation. But I do understand why people worry about these things, because it's very natural to worry, and maybe it's very natural to worry about your family members or, other people that you worry even more than yourself. But, there's no reason to think that these vaccines will have any problems long term. We'll keep an eye on it. They're very similar to other vaccines.
Thank you. So the fan mail's still coming in for you, Sheikh. I've had one from Ruth Jacobs as well, saying what a wonderful speaker you are. So that's brilliant. So now then, let's go to one or two practical things. First one comes from Salma Yaqub, and I'm going to ask Sarah to answer this one, because I know this applies in all three CCGs. So I'll just choose you, Sarah, for this one. What are the plans for vulnerable people with disabilities who may not be able to make it to the vaccine centre? And can I just add the housebound to that as well, please, Sarah? Yeah.
Great. So vulnerable people and the housebound will be vaccinated at home if they are truly housebound, or they define themselves as housebound and unable to attend. Really remarkably, I'm not sure what Rizwan's found, but we found that lots of people who haven't been out of their house for quite a long time actually were so keen to have the vaccine that they moved heaven and earth really to get themselves into vehicles and to vaccination centres because they really wanted to be vaccinated. But if people are housebound, then in Coventry and Warwickshire, and I'm sure it will be the same across the whole of the West Midlands, there are teams of either GP-led teams or some of our community service teams who are going out to visit people and vaccinate them in their own homes. So that is, and then for the vulnerable who are worried because they've been shielding for a long time, our vaccination centres are COVID safe places. So there's social distancing, there's appropriate infection prevention control measures. So actually people who can get out but who've been a bit worried about it can be assured that the vaccination centres are as safe as we can make them and are places that we would encourage people to go to get vaccinated.
Lovely, thank you. And just to follow up to that, how do you identify to the vaccinators that you need to be visited at home if you are disabled and not able to come in? What do you do to draw attention to that?
So what we're doing is we've been phoning people or using a booking systems to actually as the primary care led service, not the letter. That's very difficult to self-identify yourself as housebound with the letter you receive nationally. But when you're called by your local team, you can identify yourself then, Most GPs will know who their housebound patients are because we have the flu programme every year, which we've got our list of housebound patients that we normally vaccinate. But if you haven't been picked up in that, when you're called by your local vaccination service, do explain that you're housebound and that you're not able to, and provision will be made. I know that some centres have got provision for those with mobility difficulties but not totally housebound to almost drive up to the door of the centre, stay in their car, a vaccinator will pop out, vaccinate you while you're in the passenger seat of the car, you can wait and then off you go, so you don't have to walk around very far at all. But you let us know. There should be nobody now who is 80 or over who hasn't had the vaccine because they're stuck at home. If that's you, now really we've been given the message, don't call us, we'll call you as the NHS. I think now if you're over 80 and you haven't been vaccinated because you're housebound, then it probably is the time for you to be contacting your healthcare professional just to alert them to your situation.
May I also add to that the Birmingham Community Health Foundation Trust have been quite actively involved in making sure that the district nurses and all other allied care staff who look after the people who are housebound have been actively vaccinating them in Birmingham. In fact, I also need to probably put a shout out to Jaguar Land Rover, who have leased a few vehicles to some of the vaccination sites to go and pick people from home, bring them to the vaccination site, and then take them back home again as well. And like Sarah has pointed out, that a lot of people who have been housebound are the ones who are shielding and need the vaccines the most, and have been quite active in seeking the vaccine and making sure that they've attended as well. So thank you very, very much as a GP to them. It has ensured that you get the vaccine early, but it has also helped us making sure that we have less people to go out.
Thank you very much, Richard. And the next question is for you, and it is equally practical, and it simply says, where are new planned sites going to be across Birmingham? Or is the answer that actually you've got enough sites at the moment and you don't need new offers of sites?
There are enough sites in Birmingham. Like I said, that we've got 32 PCN-led sites from general practice. We've got 3 hospital sites, Millennium Point, and we've also got various pharmacy-led sites. But what we are looking at, particularly quite actively, is inequality, and we're targeting areas where there is inequality to make a vaccination center available to them. So, for instance, we are still looking at some mosques as becoming a site. We're looking at gurdwaras. We're looking at various different areas within Birmingham where we can make, if we can encourage those populations, particularly hard to get populations to become vaccinated, then we are quite happy to look at that. And as a CCG, we have been quite actively having conversations with faith leaders and community leaders regarding ethnic minorities and regarding inequality, particularly because we know that that is one of the factors that will be quite prevalent in the vaccination uptake.
Thank you. And then the next question goes to Dr. Banerjee, and it comes from Councillor Wahid Rasab in Walsall, and it talks about practical steps being taken for vaccinating the BME community, and a suggestion's being made that much as the idea of this exchange is to help people build confidence, could you provide speakers to go to each faith community in their place of worship to answer public concerns, even though the meeting in the place of worship would probably be virtual at the moment? But can you provide people who go and do that reassurance in those places? And indeed, the Sheikh may want to comment on this as well. But Ash, is that something can be done?
I mean, I think we can definitely look at that. I mean, there are different models of how we could do that. Do we do engagement groups? Do we do other leads? You know, the kind of a train-the-trainer model. So yes, I was happy to explore that if he would like to contact me. Or I mean, the way it works is that each local system will be leading the delivery, as you've got Dr. Sarah and Dr. Rizwan today. So it may be something for the Walsall system, but you know, we are also part of that. So whether it's maybe a local GP or maybe Public Health England, we can certainly have a look at that.
And just to add to that, sorry, Andy, just to add to that, please. I think Birmingham Solihull CCG have actively been speaking to all our faith groups, including the masjid groups, the Black pastoral churches, and various other community leads to make sure that we're available at any given time should there be any questions, and we're available to speak to the congregations as well.
Brilliant. There's a very practical response. And then the next one is also for you, Ash. And actually, I've got the same question from two people, David Babington and Reverend J. Nicholas Latham. And it's actually about whether faith leaders themselves can qualify for being vaccinated, because obviously they are doing a critical role in the community. Now, I know this is not a decision taken locally, the vaccine prioritisation, but you just want to say a little bit about where that sits, Ash, if you don't mind.
Yeah, sure. So there are the priority groups 1 to 9. So within that, you've got the age cohort. So obviously, if you're within the age cohort, you're eligible. And then in terms of occupational, we have care home workers, health and social care workers, and frontline health and social care. So there is a bit of latitude in terms of how we define a frontline health and social care worker. So it may not be just the traditional definitions of that. However, the program is not there for key workers. So it's not there to kind of help the business infrastructure or keep the country going. This bit is about stopping the deaths. So if we get through groups 1 to 9, we'll stop 98% of the deaths. That's where this is about. I think in terms of key workers, that's probably the next element, or that's for government to decide how they do phase 2. But there is some local discretion in terms of there are some jobs which could be defined through the health and social worker kind of scheme. So it depends how you define that. So I'm trying to give some examples. I've seen the social care workers guidance. So he talks about, I think within that, possibly complementary therapists and people like that would be part of social care, which people may not automatically think are part of social care. So, there's a bit of latitude, but it's not around key workers, it's around health and social care workers.
And you must be telepathic, because the next question was from David Bell about key workers. But David, you've heard what's described there. The key workers, as described by the government in the first wave, are not as yet invited for vaccine ahead of their age group, is the situation. So that's correct, isn't it, Ash?
Yes, that's right.
Thank you. Okay, now the next one comes from Jagtar Singh Gill, and it's a bit of an observation and a question as well. And it talks obviously about we're in a sort of battle of wills, his words, not mine, to ensure the right messaging gets across. So languages is key. And obviously doing things in own languages is key. It says the BBC are providing a platform to record Q&A in different languages, and the British Sikh Doctors and Dentists Association have recorded a Q&A in Punjabi. So is there anything anyone wants to say about what's been done in their respective areas in own languages to help get messages across? And I know you'll all have an answer to this. So Sarah, you can go first. You're waiting to jump in. Yeah.
Well, I think yes, I'm sure we'll echo what all the others are gonna say, that absolutely, and the answer to one of the previous messages about can we go to places and give a message, absolutely. But what we're finding is that key community leaders giving that message is far more powerful than us turning up. But we've got doctors who are speaking multiple languages, giving a sort of a medical commentary on the vaccine locally. We've got things translated into multiple languages where we don't have native speakers. We've so many languages spoken across our city that we can cover most of them with our health and care staff being able to translate and speak native languages, but there are others where we are having to employ translators and things being translated into multiple languages. We've had some funding bids able to help us with that, and our Marmot partnership across Coventry is doing quite a lot of work with different communities to look at how businesses, how infrastructure can also get involved in positively spreading the message. So some of the best things I've seen are things like we've seen from you, Sheikh, about actually doing the message yourself, having your vaccine and promoting a positive message. So I would really advocate that, but we are doing all the traditional things and pushing the boundaries to really get as many languages covered as possible. And also not forgetting, actually, whilst our minority ethnic communities are vitally important, we're finding a cohort of perhaps poorer white pockets of community who are actually, as of many others, got lots of other concerns and economic concerns, housing concerns, and this is not maybe top of their priority list. So making sure that no areas of society are forgotten is going to be really important.
Thank you. Okay, anybody want, Rizwan, do you want to add to that about languages?
Yes, I think the West Midlands is quite a diverse population. I think particularly nowhere is more diverse than East Birmingham, which I represent as the lead GP. And I think Birmingham Solihull CCG took an active approach in making sure we were reaching out to all our community and faith leaders, but also whilst we were reaching out to them, we made sure that they were making the messages in their own languages, either via their own medical practitioners who belong to those communities, or otherwise by their faith and community leaders within those communities to promote the vaccinations as well. So there is a bank of foreign language vaccination videos on the Birmingham Solihull COVID vaccine site. And you can find them in various different languages, from Swahili to Gujarati to Urdu, Mirpuri, Punjabi, etc., etc.
Brilliant, great resource. Right, brilliant. Okay, now I've got two questions next about the specific situation in Walsall, which Justin Barney mentioned earlier. So the first one I'm going to put to you, Ash, and it comes from Mark Goff. It simply says, what does Ash know about the new local surge testing in Walsall following the single South African variant found there? So how is the testing in Walsall actually happening? Now, I don't know if you're briefed on that or not. Maybe an unfair question.
No, sorry, Mr. Yeah, I'm involved really around the vaccines at the moment rather than the PhD testing side. So I'm not sure what's going on there.
So I think, and the second question around this, and I'll come back to what's been said, Mark, is that from Josh Giltrap, and it says, have patients with the variant been turning up at Walsall Manor Hospital? So the thing I want to stress, and I may be slightly better briefed than others here, is there is a single case. This is not a lot of people who could turn up at the hospital. There is a single case, but because, as Justin said right at the beginning about the need to bear down on this, what is going to happen, and literally it's just being set up now, so we're very, very early, Mark, is testing in the immediate vicinity of where that single person lives. So please, we hope that this has been caught very, very early and that testing can eliminate it. It is not the case that there have been multiple visits to the local hospital. I hope that is clear. And exactly how that testing will happen, I think that's been dealt with by the team on the ground in Walsall literally this afternoon. Hope that is clear. Right, now then, I've got one or two more. Now, a community we've not talked about at all, I just want to call out. The question comes from Jennifer Jones-Rigby, and it says, we found that the take-up of the vaccine in the African Caribbean community is increasing, particularly in the Pentecostal faith groups. All jolly good, we're getting the right messages across, the buildings are secure and safe, everyone's confident, but is there anything more that anyone would be recommending for the African Caribbean community to be doing to help? That is the specific question from Jennifer. So anyone, Ash, I might turn to you. Is there anything you particularly want to say there, or anybody else?
I just say, I think it's just the same as we've said, so it's the messages around, it's safe, it's effective. Please, wait to be called. If you get called, please do go along, get immunized. Once you've been vaccinated, you will have to carry on with the precautions. Try and, I think the messages around not Facebook, but the kind of social media is really important. Don't spread things which may be wrong. Maybe you can't trust everything you read. And it's also quite important actually with myths not to over amplify them. So we do know if you start talking too much about myths, that can also actually give oxygen to the myths. So it's quite a difficult balance here, because if we say too many times X is not true, it's a lie, people think, is it true? I've heard it so much. So there are some things. So I think it's good to take myths head on and talk to individuals, but don't amplify them. Don't add kind of fuel to the fire. And otherwise, it is just. And I think the listening bit's really important. So it'd be useful for people to be our kind of eyes and ears on the street to see what people are saying, what the concerns are, so we can then respond appropriately.
Okay, thank you. Now I've got probably the most, in a sense, horrid question here, but it's been asked, so I shall read it because I think it's important to get it out there, from John Evans. And it talks about, great that there is the resources we've heard about from Rizwan available, but he hears fake news, for example, about aborted fetuses being used in the process of production. I presume, Ash, that is complete and utter nonsense.
Yeah, there are no aborted there's no aborted fetal material in any of the vaccines either, or any three of the vaccines.
Thank you very much. That's extremely clear. And then I'm going to just ask everyone for one final word in 1 second. I do want to read out again, in the spirit of complete openness. Gulam Borough from Coventry said, just sharing the data in terms of the impact on the Muslim community in Coventry. In 2019, we had 35 burials, increased by 100% last year. And already in January this year, we've had 30 burials. So we all understand just the scale of the challenge that this disease is producing, and of course it's why the vaccination is the way out. But Gulam, thank you for what you and your community are doing, obviously, to deal with each of those with the dignity that it deserves. Thank you for that. And then I am going to ask each of you just for a last thought, and we'll go in the reverse order to how we started. So Sheikh, do you want to start?
Yes, my last message is thank you so much, Andy, for organizing this. Is that you know, NHS is tested and trusted for many years, and the same NHS are telling us this vaccine is trusted. Go for it. That's my message. Yeah.
Go for it. Thank you very much. And to Dr. Rizwan Alidina.
Yes, thank you, Andy. I think I've got a couple of messages. The first message is that we recognize it as BSOL CCG that there is inequality, and that is something that we're working actively to make sure that we are addressing. But also we are open to suggestions, to communication from whatever community who wants to discuss any concerns with us, and that we are more than willing to engage with all the communities so that we can see an increased uptake on the vaccine. The final thing I would like to say is make sure that, and this is personally from myself, is that make sure that you have verified sources in social media if you're going to share them. There is a play in social media which says sent as received, and that is being entirely irresponsible, because sent as received doesn't absolve you from your obligations if you're putting 7 or 8 or 10 people off from the vaccine who need it the most. So my personal message is, please make sure that if you are not going to take the vaccine, don't propagate and amplify the fake news across. Thank you.
Thank you very much indeed. And then we go to Dr. Sarah Raystrick from Coventry.
Yeah, I think echo the same things really. I would say on the social media front, you know, is it kind? Is it helpful? If it's not kind and not helpful, don't share it. And yes, across our 3 CCGs, across the area, the whole patch, we want to listen to you as well. So please, if there are messages you're hearing consistently or questions that we need to answer from either a medical point of view or from just a general information point of view, please, we are here. We want to listen and know what the barriers are. Thanks.
Thank you. And Dr. Ash Banerjee?
I think I would just say that, you know, I totally understand why people are scared of COVID and why people are worried about the vaccine, because it's a new thing and they're trying to understand it better. And, you know, as we go in this lockdown, it is very difficult for people, you know, physically and emotionally. But I think the vaccine is our real route out of this. So, you know, our route out of the lockdown and our route back to some kind of normality. So it's maybe difficult, and the tension and the stress you're feeling is quite understandable. But, you know, it is safe, it is effective, and it's our way back into some kind of normality.
Thank you very much. And I've just got 3 other observations I was going to sort of read out at the end. One's from, I don't know if it's male or female, N Rose, and it says, if the vaccine is completely safe, why is no one to be held accountable? Well, of course, everyone individually is accountable for their own actions. That's perhaps the critical point. I'm getting some nods, and the whole purpose of this is for everyone to have the very best information so that then they can make their own decision. I'm sure there's a legal answer to accountability as well, but we won't get into that. The spirit of this conversation is about that individual notion. And then from Wahid Rasab, who just talks about his own experience, but then he says it's time for unity and working all together. And I hope that we've seen this afternoon an incredible piece of unity on display. And the last contribution comes, and I've managed to get through all of them that were brought in, hopefully just about on time, comes from Mubashir Ajaz, Head of Wellbeing at the Combined Authority, who just, and I think I left this till last, he said, I just want to congratulate colleagues who have worked so hard to get the vaccine rolled out, and especially to all of our vulnerable groups across the region. And if you think of the first report that we did on the impact of COVID on different groups across the region, and particularly BAME communities, this is an admirable example of a decisive response to that. So can I just conclude by saying thank you for those who stepped forward to share their expertise today, and thank you to everyone who's working literally night and day to make sure the number of vaccinations is maximised, and I hope you all take that message forward. Thank you very much indeed, and we'll conclude there. Thank you.
Thank you.
Thank you.